Welcome to the Training Stimulus podcast. In today's episode, we are rejoined by our special guest, Tash Osgood. We're talking about what do most chiropractors miss. This is a great episode where we talk about all the facets and features of Tash's very holistic practice, where she combines traditional chiropractic treatments with movement mechanics, with rehab, with some strength and conditioning, and how she finds the perfect blend to get the best results for her patients. We also have a few tangents off into uncharted territory, talking about psychological issues and how they can impact people's movement, how trauma can relate to pain, and the more spiritual side of things, which is somewhere I didn't anticipate going before the episode, but it's something I've wanted to talk about for a while. So it's great to riff on that with Tash. But without further ado, let's get into it. All
Hi.
right, we're on. Tash. So straight in, big question. When you think about chiropractic, what do you feel it does really well when it comes to helping people out of pain?
It's a good question. So I definitely feel like as a chiropractor, in my opinion, we try and see the body as a whole. We don't just look at like your bones, your joints, your muscles, like we kind of look at the nervous system. We look at the whole person as a whole, like what's going on in their life, etc. And I think when you paint that picture of that person rather than just the injury and the pain, I feel like that actually helps them get better quicker
Mm,
because they get an understanding how their lifestyle can actually be influencing their pain. For example, if they've got high stress in their life at the moment, that's going to reduce the chances of inflammation calming down and reduce the chances of recovery being quicker. Um, it's also kind of when you look at the nervous system, like you don't realize how much your nervous system impacts the body. And I feel like sometimes other professions don't incorporate that as much as we do. Um, the main thing that I do find is with quite a lot of people is we do get quite quick relief from pain. So with adjustments and with treatment, there's a lot of people that do come in who could have maybe be in like an 8 out of 10 pain and they could walk out with like a 3 or a 4 out of 10 pain just from that treatment. And sometimes it could be even like the pain's gone like completely. And that's where I think adjustments, which is the main, I guess, tool set that we use, has a massive benefit, because there's sometimes like soft tissue work isn't enough. Sometimes the adjustment actually might help not just get the joint moving better, but get the nervous system working better, and also therefore get muscles, tendons, joints, etc., just working better as a whole. Um, and I think that's where we work really well as a profession.
very cool. So for the adjustments, I think, yeah, that's probably the thing that chiros are best known for.
Yeah,
It's to people on the outside, it seems very risky if done poorly. So I guess
yeah,
a lot of the education centers around how you do that correctly and
yeah,
safely.
yeah.
Can you give us any insight into what the general rules or principles are for adjustments? Like, what are you trying to achieve, and what are the do's and don'ts?
Yeah. So the whole principle of an adjustment is like the main one is obviously to get more movement through a joint, but also it helps with the nervous system to fire up better. It also helps with like tonicity within a muscle and the surrounding muscles that are provided from that nerve, like let's say from the spine. However, there are times where people shouldn't adjust. Um, that's I would say from university, that is what you are almost taught more to do than when to adjust, like in
Okay.
terms of safety. Like, and there is always times where you shouldn't adjust someone. There's always a time, and you've just got to know when that is and when that isn't. Um, for example, anyone who's got um, hypermobility disorder, so like EDS, for example, no, don't need to,
Mm.
like, no way are you adjusting them because they've already got too much laxity through their joints. And if you adjust, that could do a lot of damage to them. You wouldn't want to adjust anyone who you think has got like osteoporosis, anyone who you can do certain adjustments in certain parts of the body, but not other parts of the body. For example, if someone's at stroke risk, you don't adjust the neck. Like anywhere else is fine, but you wouldn't adjust the neck. Um, there's some incidences where you can adjust the lower back if they've got a disc injury or not. God, I'm in the sun now. Um, um,
Mhm.
because there's some people that the adjustment would probably really help, and there's times where it wouldn't, and you've just got to make that decision. So for me, I tend to not initially, and then if I feel like, right, okay, maybe the last little missing piece might be an adjustment, you do a gentle adjustment to try and get the joint and the area moving a bit better. Um, but you've just got to use, like, again, like we've said in previous podcasts, like that history taking is the most important part for you to understand when you shouldn't adjust someone. And sometimes like you can adjust someone and like it might have just aggravated it, or they might not respond to an adjustment for no other reason apart from that's just not how their body wants to react, and that's
Yeah.
fine. If they don't respond well to an adjustment, you do something else. You do mobilizations, you use other techniques. You don't have to adjust. Like for me, if someone comes in and they don't want an adjustment, they don't want an adjustment, and I'm like, okay, that's fine. We just do gentle mobilization, or we do any other technique so that you still can get the same result. um so yeah, and like I think like I guess elderly, you've got to be very careful. Like some patients, I would probably say I don't. I'll maybe do like a gentle adjustment, but again, you've just got to be so careful because of osteoporosis risk, all of other like pathologies and stuff that could be going on with the elderly. You've just got to use your judgment as to whether you think that's right or not. And also, I think there's a this whole vision of a chiropractor being really aggressive with their adjustments, and you really don't have to be. You see these videos on TikTok and stuff, and they're savage. They are so savage. And like, don't get me wrong, like sometimes like someone, that's what some people might need, like because they're quite hard to adjust or something. Like I always say to people, if you actually watched how I adjust or what I do, like it's not that big of an adjustment at all. It's all about just trying to get them into the right position and just doing it, like doing a small like I guess pulse or push or whatever, just so that you can actually get the effect from it rather than it being this aggressive thing that people seem to think that chiropractors do.
Yeah. No, well, I think that's a lot of what we're going to talk about today is perception versus reality. But in your expert opinion, if you had to summarize the classic chiropractic approach into one sentence, how would you describe it?
The classic chiropractor. Classic chiropractor approach is therapy where they incorporate spinal adjustments, where they would probably want to see you more frequently initially and then slowly reduce the frequency of treatments to help with your pain and your injury.
Okay, very good definition. Thank you. And where do you think most chiropractors hit a ceiling with their results following this classic approach?
I feel like, so for example, if a chiropractor doesn't do much soft tissue work, that's going to be a start. That's a massive gap where some people might be having injuries, like if someone's got like tendonitis, for example, if they ignore doing any form of soft tissue work, that's a massive gap. Um, the main one is obviously going to be if they don't incorporate rehab, basically, because as we've touched on multiple times before, like that's the thing that's going to make the body more robust. That's going to be the thing that's going to actually make longer lasting results, because their body's able to actually cope with the demands that they're asking of the body to do when they actually are in pain. Whereas if you just treat someone, you've treated the symptom, you've got the pain gone away. Pain gone away. That's such bad English.
I understood.
God, um, to help the pain go away. And but it doesn't, like, it means it still will come back because the muscles, the ligaments, everything around it is just not strong enough to stay like that. And that's, I think, the main thing. That is the main thing that a lot of chiropractors miss.
Yeah. And is that a limitation with chiropractic as it's taught, or is it just a limitation of how it's applied in modern practice? Like, I'm not a chiropractor, so I don't have a good understanding of the standard syllabus of when you're getting qualified as a chiropractor. But it seems to be a story that a lot of our chiros are telling me that there is a an omission in the standard syllabus. Is that
Yeah.
your
So
experience as well?
it's so I think there's quite a few things that have changed probably in the syllabus since I graduated, but I wouldn't say it was. To be honest, when we were at uni, that was maybe one thing in the syllabus that I don't think they taught well enough, is in terms of when someone comes in with an injury, what is your judgment in terms of how you how often you treat someone or what you would do in that session. Like, I think that was the one thing that I felt scared of when I came out into professional practice. So I actually think a lot of these traditional, like, chiropractors, it is all when they come out and it's how it's applied in business and stuff. Because um, if you literally put about 10 chiropractors in this room right now, you would every single one of them would be different, like completely different how they practice, what they do. Like, they obviously teach us soft tissue techniques at uni, but there's some chiropractors that literally will just do adjustments. And you've got like some who are like these open plan chiropractors who will adjust people like what be on benches like next to each other or something like that, and they'll adjust quickly and then you're in and out in 5 minutes, which is beyond me, but okay. And then you've got like these other chiropractors that do a bit of everything, like for like 20 minutes, half an hour. And then you've got like the other end of the spectrum, which is like myself and quite a few of my colleagues who will do obviously adjustments, soft tissue work, rehab, etc. So you've got like a whole spectrum of chiropractors at the moment. And that's why when people go, oh, you're going to see a chiropractor, it's like you can't judge it from this traditional chiropractic technique, because there's so many, we're so different. There's so many people that are so different.
Yeah, it does seem like there's a huge uh, range of techniques that will be applied by different chiropractors. And yeah, like you said, you see both extremes. I had put a rant post up recently because I was chatting to a guy who's a chiro, and he was basically saying, "Oh yeah, I'm not interested in movement mechanics because we don't do any exercise prescription in our clinic." And I was like, "Oh yeah, okay. How does that work then? How do you operate?" And he said, well, we operate on high volume, and so we can see more patients in a day. I was like, okay, what do you mean? Like, what's high volume to you? And he goes, well, we try to get people in and out of the adjustment room in 2 minutes. 2 minutes. Like, I've never heard anything that short before. But I like even the fact that even like saying it out loud, I thought he must realize how ridiculous this sounds, that you're literally having people just churn through your adjustment room. Like, there's not even enough time to clean it. Do you know what I mean? Like,
But the problem with that is that infuriates me. I'm like, what effect are you getting from that? And I think this is potentially another thing where, like, I think chiropractors hit a ceiling, is where when you've got like clinics like that, patients do not feel seen, they don't feel heard, they literally feel like just a moving chess piece, or literally like on a what's it called,
a factory
like,
production
yeah,
line.
yeah, like. And it's just kind of like they turn up, you quickly adjust them and they move on. And it's just like, that is one thing that I feel like I really, really pride myself in my service and my care, is that I care and I listen. And I think that's half of the reason why a lot of people like coming to see me, because they actually feel heard. They know that I understand what's going on, I can relate. And if you've just turned up and you've been having like the worst time with all this pain, and someone just goes get on the bench, click, and then go, you're gonna be like, what? Why have I spent like 60 quid for a 2 minute adjustment? Like, it's ridiculous. It's just it's like, in my opinion, like it's just I don't. If that's what people want to do, that's fine. But I don't personally agree with it. If I'm honest, I
No,
don't feel like
no,
it's ethical, and I don't think um, you're in it for the wrong reasons. To be honest, if you want the money, then great. Um, I don't think you're in the profession for the right reasons at all.
not at all. I think it's staggering from both perspectives of both the practitioner. Are they able to convince themselves that they're doing people a real service? And then also as the patient to think that they're actually getting what they need out of a 2 minute adjustment. Because I don't know how often they'll be coming to see him, but how many times where you turn up, get 2 minute quick click, get sent packing, do you, before you think, is this actually fixing me? Am I actually getting
Yeah,
better from this? Or is this just, a weekly appointment, like, or a regular thing like a haircut or something where it's
yeah,
just, oh yeah, I've just got to go and get my quick click and
yeah.
then be on with the rest of my day?
And then it's like when people probably go like, "Oh, I'm just gonna pop to the chiropractor," and they were like, "Oh, oh, we can push coffee later." No, no, I'll literally be 5 minutes, and I'll be out. It's just
Yeah,
ridiculous. It's
keep the
just
engine running. Like,
yeah.
don't put any money in the meter. I'll be right back.
I literally, it is so laughable, and I am just very much on the very other end of the spectrum of this, like very much. And I think there is a lot more chiropractors who are probably more my end, um, but there are just sadly chiropractors who like that, and that's great. If you just want to have very nice cars and go on all these nice fancy holidays, and you don't really care, gonna swear then, don't care about actually helping people, then that's what you want to do. Like, that's probably your ball, but it's not mine. It's not
Yeah, no, I completely agree. And yeah, it's difficult, I think, without wanting to open another big can of worms, but how do you differentiate yourself from those chiros? Because to somebody who doesn't know, you're all chiropractors. And I definitely had this uh, incorrect opinion for several years after being a patient of one of these kind of guys. I think I spoke about it in a previous podcast
yeah,
where he would triple book appointments and then he couldn't get me out of the room fast enough, literally just quick adjustment, didn't want to talk. And I was like, oh, what? So this is chiropractic, is it? I'm not keen on
yeah.
this.
Do you know what? This kind of links to me and Bradley have been having this conversation with ourselves, because we are chiropractors, because that's what we are qualified in. But we try and keep thinking of like, we aren't really traditional chiropractors. We do so much more than that, and it's kind of like, so the amount of people that call me a physio, and I'm like, okay, if that's what you want to call me, am I getting you better? Am I getting you the like outcome that we want? Yes. Well, you call me what you want. It doesn't bother me. Some people still call me an osteo, and I'm just like, yeah, fine. Like, I'm not. I think also I am a chiropractor, and I pride that I am a chiropractor, but I'm not that precious about what people call me. Um, because at the end of the day, as long as I'm getting them the result that they want, and they want to get pain free, and they want to move better, and they want to have a better quality of life, if they're coming out of the sessions and they're feeling like that, then that's fine. And I think we kind of came up with, what did we? I think we came up with a like sports rehab chiro is kind of like what we were saying that we are. Because that, I think, summarizes us. It's a bit wishy-washy, but like that summarizes what we do. And I think it's so hard to try and get people to understand that without experiencing what you do. Like, unfortunately, like you can't get people to be like, oh, I'm a chiropractor, and then people go, oh god, you're one of those. And it's just like, i'm not I'm not the same as all the other chiropractors. Like, I'm not. and then I have to almost like sit there and explain. And I think that's really, it's it's almost detrimental for people like myself, like Bradley, like other people who treat like us, because a lot of people have this perceived vision maybe of chiropractors who do even open plan, or they literally, even if it's like a 10-15 minute appointment and they quickly just do some adjustments and then that's, you're on your way sort of thing, or they've just had a bad experience with one, whatever that might be, they then almost have that mistrust in the chiropractic profession, and that's not obviously what we want, because we want to build the profession, we want to make sure that people trust us and etc. And I think that's what I think some people, like some people struggle with coming to see chiropractors, is that they've had that bad experience or they hold on
Yeah.
to it. Where there is actually majority of people who've seen a chiropractor have probably had a good experience, but you do have that small amount of people that haven't, and you hold on to it. Like I know when I've had a bad experience with, I don't know, going to see a hairdresser, let's say, and I wouldn't go back there because, but I haven't painted all hairdressers with the same brush. Does that make sense?
Mm.
So it's but it's
Yes,
very
absolutely.
difficult. It's very difficult to try and differentiate. Um, I always feel like I have to explain myself that I'm just not the same. Um, yeah,
Yeah, it's tricky. It's tricky because like, I struggle with the same thing where a lot of people would say I'm a physio when I'm not, and people come to me thinking I'm a physio, having that conversation with them. And one thing that I think is common between good physios, good chiros, good osteos, good personal trainers is quite often the reason why they're good is because they've learned things outside of their profession. So the reason you're good at what you do is because of the stuff outside of chiropractic that you've learned. You're very good at the chiropractic stuff as well, but it then becomes a weird conversation because you're not good in spite of it, but you're good for reasons that are not it. So by somebody calling you that, it's kind of bucketing you or pigeonholing you
yeah,
into the image people form in their mind of like, oh, Tash is a chiropractor. So they just think you do adjustments and maybe you're good at adjustments, but that's not really what they're looking for. So I've struggled with this for years now. Like, how do
yeah,
you neatly encapsulate all the things that you can do for somebody?
yeah,
And it's really more about their situation than it is about what tools you're going to apply to them, which is, I guess, maybe that's why you rebranded to Osgood Movement rather than chiropractic, because you're helping people move
yeah,
better rather than you are a
yeah,
chiropractor.
100%. And that's what I wanted to encompass with the rebranding, is because yes, it was like Osgood Sports Chiropractic, and that is kind of what I do. And but I just was like, I also brought two people on, so I brought Bradley and Beth on, and Beth is a sports rehabilitation therapist, and I was like, I don't want the whole it all to be branded just under chiropractor, because I want to offer more than that, and in the future I want to bring on other people and other professions in, and I was kind of like, what encompasses what I do, and I was just like, I do just want people to move better. And that was like, we thought of it. We were like, Osgood movement therapy, Osgood movement this, and I was like, why don't we just do Osgood movement? Because that's just encompasses what I want to do, what I know Beth wants to do, what Bradley wants to do. Like we all had the same philosophy and the like same vision of what we want from our patients. And I was like, that that is what I want. So yeah, like that's exactly why we rebranded it to that, because um that's the whole point, isn't it? Like surely for people, like you want them to be able to move better, whether that is in their sport or their day to day. Like you want people to move better and feel pain free and like improve performance. And yeah,
Yeah, yeah, definitely. It's about the outcome rather than the techniques you're applying. And
yeah.
I think that's kind of the way it should be. Um, okay, so in light of you adding all these strings to your bow, and developing a good understanding of biomechanics and training principles, load management, etc. Has that changed the way that you will use adjustments in your practice compared to a traditional classic chiro?
Oh, good question. Um, yes and no. Yes and no. So I I find, like, obviously initially when they first come in, whatever treatment I feel appropriate, they'll have. But the difference is when they then come in for further treatments, hopefully with the movement mechanics, their rehab and everything, things are feeling so much better. If I don't feel like they need an adjustment there, they don't get an adjustment there. They don't have to have an adjustment because I'm like, well, that's moving so much better. This feels great. Like, it's very easy to get into the pattern of, oh, they're coming in for treatment, so they have to still have all of these adjustments when actually they just don't need to. They and I think, again, a lot of chiropractors will probably disagree. They probably just adjust it anyway. Um, but if I don't feel like they need it, and I find, right, okay, well, from that area, maybe it's actually just because that glute's really tight. So I'm like, I'll loosen that off, and that's more what I felt from the testing, from what I can feel. I'm like, that's probably more what they need, rather than it being, oh, we have to adjust the lower back because they've got a bit of lower back pain. And it's like, well, if you don't need to adjust it, you don't have to. And I think I found that by incorporating everything, it just speeds up the process of the body feeling better, moving better. Therefore, you don't need to do adjustments all the time. Like a classic one is cervical adjustments, so neck adjustments. I find that I will only adjust someone's neck once I've treated the rest of the body. So, for example, I find that a lot of people who get neck pain and issues through the neck is potentially because of compensations coming from the bottom up. So I tend to treat bottom up, so from your feet up, and then some, more often than not, the neck actually is fine by the end of by the end of it. So before I then go to do anything else, I'm like, well, your neck actually feels okay. Um, so if I don't need to adjust it, I don't adjust it. Like, more often than not, the neck is actually sore because their jaw's really tight. And it's just finding it, you've just got to use your gut, and also, like, from what you found from that day. Like, don't just sit there being like, they've come in with neck pain and shoulder pain, so I have to do X, Y, and Z to treat this person. Like, you have to do all of those things. Like, use your testing, use some of your movement mechanics, use whatever you want to make a judgment as to what you should do in that treatment that day. Like, every treatment should be slightly different. Like, there's some people that you are going to have to treat a bit similarly if they've got um like a rotator cuff tendonitis or tendinopathy or something. Like, you're going to probably do similar sort of stuff to try and calm down that inflammation, take the pressure off of certain things, blah 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 blah. But if someone's coming in with a slightly different symptoms, you're going to treat them slightly differently. Like, you can't just do the same thing all the time. And that's what I have found with my approach. And that is, even, I'd probably even say, aside from the movement mechanics, like, that's just how I've always treated. Whereas I think there's a lot of chiropractors
Mm.
who would just be like, right, we're going to do a lower back, a thoracic, cervical adjustment, and bish bash bosh. Just
Yeah.
just don't think it's necessarily, not everyone's body is the same.
Yeah. Yeah. Spot on. And you've kind of answered this next question already, but maybe we can elaborate on it
Yeah.
slightly. So I was after an example where maybe the traditional chiropractic treatment might have plateaued in terms of where you're getting somebody, but you've used a more holistic approach. You've applied movement mechanics, and from what you said there, my interpretation of that is that when you're applying movement mechanics well, the adjustments are not necessary because they're almost adjusting themselves through
Yeah.
moving better, and then that pattern sticks around longer. So is there any example that jumps to mind when you think of, you're glad that that person came to see you rather than a traditional chiro, because, or maybe they were seeing another chiro and they weren't getting anywhere, and then with a more sophisticated approach they ended up breaking through that plateau or getting further improvement compared to what they were getting with somebody else?
Um, yes, I can think of one currently, and it's been he wasn't seeing a chiro. He just saw like a sports massage therapist, like once a month sort of thing. And we did a movement assessment on him, and I think this links straight back to what we said maybe the last podcast or the podcast before about how your body, when you give people movement mechanics, their body is constantly adapting, so the body is then constantly changing in terms of how it moves. So like we did, from the movement mechanic stuff that we found, things got better, but then he found like something else kind of got triggered a little bit. And then we were like, right, okay, so let's do a little reassess, let's see what's going on there. And by me doing the movement mechanics stuff and find hello? And
Still there, still
okay,
there.
and finding there was, I think it was basically he's every time he ran, his back would just blow up completely. And so from the movement assessment, and originally there was a few things for like his lateral hip stability, um, and accessing his posterior hip. And then we did the movement assessment again, and then actually we found his hip flexors were just doing nothing at all. They just weren't like activating or whatever. And so we worked on his like sagittal plane movements a bit more, so into like hip flexion, accessing his posterior hip a little bit more, and getting into his obliques a little bit more. And from that, literally just from that, like he was like running feels fine, training feels fine. He feels more even when he squats, and you wouldn't have been able to get that response just from hands-on treatment. Like you just wouldn't have, because he's had that problem for ages, and as a massage therapist hasn't been able to fix that either. And the fact that like as we've seen his body adapt, we then almost like revealed what the actual problem has been. And then it's like, oh, okay, that's probably what we do. Like, and when we got him to do some exercises, it was so hard. He just was like, I can't do it. And I was like, right, well, this is the reason. Like, it's not just going to be because of X. It's going to be because you can't drive when you're running with your hip flex, like your hip flexors, you're just using your quads all the time. If your hip flexors aren't doing anything, you're not supporting your back, so your like your paraspinals, your QL is going to literally just blow up to try and support you. You're very much more lordotic than you are when you're running. Like that's going to be influencing why your back's blowing up all the time. And he came in for his next appointment like a month later after giving him these exercises, and he was just like, everything feels so much better.
Amazing.
It
Love it.
is going.
That's it, isn't it? Yeah. So I think that naturally leads to one of the other things I wanted to ask you about, which was if you were redesigning the syllabus for chiropractors at
Yeah.
university, is there anything I think we've got a sense of what you might add. So maybe let's start with what you might remove. Is there anything that you felt was unnecessary or overemphasized in the traditional chiropractic syllabus?
Um, I don't think there was anything that was overemphasized. I think what they had in the syllabus was all very safe. Like it was, I think it was fine. Like I don't think the syllabus itself was an issue. Like they covered lots of things throughout the years. Like for, like year one and two, we had like radiology, so that was like reading X-rays and stuff. And I think that's really important because we need to know how to look at an X-ray. If we have an X-ray given to us, we need to know how to like look at the report and stuff. And I think that's a skill that is sometimes ignored that chiropractors can do. Um, there's the things that obviously are missing, I think, and I think I said it before, is structuring how you would treat someone, is one thing, because that's something that you just learn. I felt like I learned on the job, if I'm honest. I kind of was like, right, well, I feel like I should probably see this person like quite frequently. Because again, if someone is really acute, you need to get on top of that pain as soon as possible. So you do want to see them a bit more frequently so that they can get better quicker. But that's not, that's individual to them. Um, so I might be like, right, you have 3 sessions a bit closer together. and then we'll be like, right, we'll see how you feel after that third one, and then we'll make a judgment as to when I think you next see me, not like this structured plan. And then obviously I'm going to say rehab needs to be into this, but I think they have started incorporating that at one of the universities. I'm pretty sure. I'm pretty sure in WEOC they've I have a feeling they've started incorporating some of that um into it, which I think is a great thing. Um and because at the end of the day, like if they're not, oh, well, I've said it so many times, like I'm not gonna just keep repeating myself, but like it's just so important, and especially if people want to work in sport and want to work in rehab, like maybe even at uni they do like half a year where they've got like an optional modules where you can go to like a sport module, you can do like a peds and pregnancy module, you can do neurology module, but if that's the route you kind of think you want to go into, so that you've got an idea when you come out of what you want to do. Like I think that would be really cool, because neurology is definitely something that I'm very interested in, um maybe a bit down the line, but like how the nervous system works, like there's so many things about vestibular and eye reset and stuff. Like I love it, I think it's so interesting, but I don't know enough about it, and I'd love to do a course on it, but it's just time and trying to make sure that I'm top of what I'm doing at the moment, and rather than trying to put my finger in too many pies, sort of thing. And I think that's where sometimes people can be um people can go wrong, is where they try and like be the best at everything, but it's just like just be good and great at what you know you're good and great at first, and then you can progress with that. But I think it would just be um knowing how you would structure an appointment and a treatment plan for someone, and then incorporating rehab would be the best things to add in.
For sure. Yeah, I think it's an interesting point you make there about having lots of different skill sets and maybe confusing yourself. I think the meta skill, as I see it, that sits above all of these health professional careers is some form of triaging. How, when someone comes in, trying to figure out their situation in a lot of detail, and then, sorry, um, it's the computer. The phone's on silent, but the bloody computer rang. Um,
Bloody hell.
um, but where was I? The meta skill of basically figuring out somebody's situation and figuring out what they need. And I think when you've got so many tools at your disposal, like you can go in so many different directions, for some people that makes it actually harder. And there's this balance to strike between, what's the saying, like when all you've got a hammer, that everything looks like a nail. So if you've got one skill set only, then you're purely diagnosing through that lens, and you just see only the issues that you know how to treat. Whereas actually, if you're able to zoom out slightly and appreciate the bigger picture and know what your tools can and cannot solve, maybe you need to refer out to somebody until you've developed that skill for yourself. But I think many of these skill sets exist in isolation. So people are only aware of what they know, of what they've been taught at university, and they're never taught the wider skill set of maybe this type of issue is actually outside and this is how we
Yeah.
refer. And that there are actual qualifications in referral. Like I
Yeah.
think if you're a personal trainer, you can do these qualifications that basically teach you where you should send people when they're outside
Yeah.
of your remit. But it's it's a tricky one. Like the short appointments, it comes back to incentives of, if your skill set is referring, then how do you get
Yeah.
paid? He's like, I can tell you who else you need to go and
Yeah.
pay, but okay, is that a
Yeah.
valuable service? I guess it is a valuable
And I
service, but
think
you wouldn't specialize in
and I
that.
think also it's those are the people that actually, I would say, when you're honest and you say to someone that you think this is out of your remit, but you're going to do everything you can to help them get better, they will still appreciate the fact that you've done what you can, because it's very easy for you to be like, okay, someone's come in with this. Like I actually have a patient that this has happened with, and honestly, like the dialogue between us has been so honest. Um, we just don't know what's going on. We literally don't know what's going on. She's got this really bad hip flexor pain on both hips, worse on the right, and it's more when she's squatting, but she also gets it when she deadlifts. And I kid you not, I have exhausted. I've exhausted all options, like absolutely all options. Like we've gone from just doing just simple hip flexor stuff. We've worked on her lumbar spine, her thoracic spine, her TL, her done breath work. We've done diaphragm like stuff. We've done jaw. I've looked at her feet. Like I literally have done everything I possibly can to try and help her, and it just nothing. Like we can't find, and like she knows, but she knows that I'm trying everything I can. She's also seen a couple of the specialists. She ended up having like I can't remember what she said. I think it was like almost like a steroid injection, but it was like a trigger point therapy. I hadn't really heard of it before, but she had that for her hip flexors before a comp, and she said it helped a little bit, but not loads. And then she actually went on the course that I really want to go on, which is all about body reset and nervous system reset, and it's called Square Systems. And oh my god, like it's just something that I'm very interested in and very intrigued. It's very wacky, so it would probably be something that I pick from. But she actually went on the course because she found it so interesting, not even as a therapist, but just as an individual. And I said, I actually think that that's something that you need, because I like myself and a physio that she's also seen, we have literally exhausted all options. She's had scans and nothing is showing, like absolutely nothing. And so because she even joked, she was like, it's probably just in my head. And I was like, no offense, but there's probably an element of it that is like you're just fearing it. And she went on this course. I just said I'd be so interested to see if like there was just a nervous like system form of reset or something that might actually help you. And she was like, it was really interesting, the course. I was like, well, let me know how training goes this week. And she went and trained on the Monday, and she was just like, I literally have like barely any pain. And I was like, crazy. I was like, okay, like maybe that's just what that person needed. And I wasn't to know that that was specifically what it was, but every time she came in, I was honest about, I really don't really know what's going on, because this feels okay, this feels great. Like, yeah, you're a bit tighter here, yeah, like this, but like I don't feel like that's causing the problem. And yeah, like I think it's very difficult because people will happily be like, oh, I can fix this. Oh, it's definitely this. It's definitely this. And they're very narrow minded. Whereas, as you said, if you step back and take that wider picture and you're just like, okay, that didn't work. So let's try this. If that didn't work, let's try this. If that doesn't work, then we'll then start referring out. As long as you feel like you've exhausted all your options and you've tried to help that person as much as possible, they actually will probably end up coming back to you, or they will still refer people to you because you did everything that you could to help them and you were honest, rather than just leading them with their money.
Yeah. Yeah. I love what you said there so much. There's so many things I want to come back to, but the, to sort of tie it up nicely with the point before, I think it relates really well to what we were saying about assembling your unique arsenal of skill sets. And because things can be so, I'm trying to find the best word for this, like not random and unconnected, but that more woo woo spiritual side of
Yeah.
things has a huge
Yeah.
influence. It's not something I talk about a lot, but it's something that I actually believe a lot more than most people would guess, that a lot of postural adaptations relate to psychological issues, essentially. So whether you've had some sort of traumas, like people talk about the hip flexor as the soul muscle. So when you have chronically tight hip flexors, because it's kind of that curling into a ball position, it can relate to you trying to protect yourself maybe in early childhood, maybe there's a traumatic event or something, and that's your kind of way of
Yeah.
bracing. And like you said, like it can be more psychological than physiological. And even just having the awareness of that, it's difficult to put that on the table during a standard qualification or degree. Like if you're doing chiropractic and they're teaching you your adjustments and they're, oh yeah, by the way, if somebody's had a traumatic childhood, they might have really tight hip flexors, which is more of a something going on in their mind than
It's
in their body. Like it doesn't
no,
really fit.
it's
So
so
yeah.
true. Like, and I think it's very difficult. Like again, that is it's 100% right, and it's not necessarily just. I actually had this conversation with I had a another chiropractor came and shadowed me yesterday, and we had this conversation about how people hold on to trauma in their body more than you realize. The amount of times I treat people and I have people crying because it's like an emotional release because that area that we treated was actually something that they were holding on to traumatically. I had someone in the other week, and I genuinely think that her shoulder issue is from trauma, like not necessarily like childhood trauma, but there's a lot of things that we ended up talking about. And she was just like, God, I've never spoken to anyone like this before. And that's another thing where a lot of people really appreciate you is where you actually listen and they feel safe talking to you about sort of stuff like that. Because I joke that I'm like a therapist half the time, but actually
Mm.
they've spoken to me about something that they've probably not got off their chest for ages, and they actually then feel better for it. And it's so important to actually understand that that actually could be a cause of why things are feeling so tight and so like that's why stress, anxiety, any like instances going on recently in your life that might be impacting it. But like not even just from a professional viewpoint for my patients, but even from myself, like when I feel really stressed and anxious, my body does not feel great. It just doesn't feel like it's working properly, whether that's it feels really lethargic or like any niggles that I normally have, they normally flare up. And like it happened, I'm going to be honest, like it happened like 2 weeks ago. I literally just had a week and it was just loads of things were going on, not feeling very good mentally. And I went to do a toes to bar and I literally think I pulled my ab and I literally just lost it. I just lost it. I was just like, for God's sake. I literally had like a mental breakdown in the middle of the session. And and I just cried for ages. But by me just letting that cry out, I didn't realize how stressed I was, how emotional I was feeling, how a lot of things were going on. And all it took was just that to tip me over the edge because my body was just not working for like on a normal any other time it would be fine doing I can do toast bar whenever I want, but that specific time because my body was under such high stress and like mentally I just wasn't in a good place, my body was like no, like it just said no. And that's what a lot of people just don't understand, like how much your mental state can impact the rest of your body, whether that's a specific muscle group or what, like your body will absolutely tell you if you're not in a good way.
But yeah, that's an amazing story. Thank you for sharing it. It's so in line with so many conversations I've been having recently. And actually, when Gary Ward came on the podcast, he was talking about this as well. He calls it reverting to your default body. So essentially, your body has a position or a posture that it will revert to in times of stress, in that it's like your survival response. When you feel under threat, it's like, okay, I think this is my safest option because everything else seems dangerous. And it's exactly the same as psychological behavior patterns where if you're, people have anger issues, it's because when they were a child that seemed to be the only way that they could survive, was just to fight fire with fire, or just, they saw their parents being angry and that's how they got what they wanted, whatever it might be. And your body has the same sort of patterns of like, in case of an emergency, revert to this posture and it'll pull you over into, slouching or just like super high alert aggressive stance, whatever it might be, but to your own detriment because you are right at the edge of your capacity. And people say it all the time, but this is a perfect example of the body doesn't care where the stress comes from. whether it's from high training load, whether it's from lack of sleep, whether it's from poor nutrition, whether it's from relationship issues, from work stress, whatever it is, it all piles on, and you can get these reactions where there isn't necessarily a physiological issue going on. And this is where it becomes a bit woo and I think super cool, is that they do merge together. Like you said there, you can give somebody a treatment and then the emotion comes out. So you're now resolving something psychological with the physiological treatment, and it can go the other way as well. And yeah, it does. Yeah, I didn't
Yeah.
expect to go here today, but it is a fascinating area for me in that I guess being out here as well, it's almost taken for granted in Eastern medicine, like in Chinese medicine and Ayurveda, all these sorts of things. They're like, of course, these things
Yeah.
are related. Like that's just a given. But I think in the Western world, it's a lot less accepted, especially when you're going through university, academia. Everything's really scientifically proven. It's hard to demonstrate that that's a fact. But so many people with so much experience think this
Yeah.
way, and my personal experience, having seen it myself several times, um, completely agree. So yeah, I'm also right there
Yeah.
with you, trying to learn more about that, and
It is.
it's
It's
very
very
cool.
interesting. And I think that is probably one thing that is just very much ignored, not just in the chiropractic world, but just in general. And when people have like a lot going on in their life, like mentally, everyone thinks, oh, like mentally, I'm just not in a good way. But it's just like you just forget about what your body does to try and protect itself. And it just goes into that, as you said, that certain response wherever, whatever it wants to do, whether it's like into like that postures, like the posture positions that you were saying, or whether it's just kind of like, right, this is a vulnerable spot for that person. We're just going to target that because that's just going to sign to them that you need to stop a little bit and just rein it back in. And it just has so much of it. Like, it's so interesting. And there's a lot of science behind it that I don't know about. It's something that I want to go into, but it's so important to not ignore it. Like to not ignore it. Yeah. Because it's just kind of like it has a massive impact on people, especially with a lot of people that you and I treat, and they're not necessarily elite athletes. They're people that have got a normal job or a very high stress job. And a lot of their training is their hobby and their stress release. And if there's a lot going on in their life, it's going to impact their training. And you need to find a way to manage that as well.
Yeah, yeah, it's a tough spot to be in when training is your stress relief, but it also creates physiological stress. But yeah, if anyone has a
Yeah, that
solution
would
to
be
that,
great.
please let me know, because I want to know the answer to that. Um, so this, yeah, I guess in this topic of more thinking more holistic and combining practices, have you got any thoughts or ideas on how these different specialists, whether it's a chiro, personal trainer, physio, coach, spiritual healer, like, do you, if you could design a perfect world, how would they all work together? Or is it more a case of individuals need to develop an appreciation of all aspects? Because it's clear that the even if we're thinking of them as movement problems can have so many different causes and possible treatments. How do we join it all up and try to get to the real heart of the matter?
I feel there's two sides of a coin, basically. I think you want to look at it from like, because for me, I started to think, I was like, right, I want to be everything, not everything, but like if someone comes to me, they know that they're getting adjustments, they're getting soft tissue work, they're getting rehab, they're getting movement assessment stuff. Like, so then they're only having to just come and see one person. So that's kind of one side where you would think, oh, like everyone should try and get an appreciation for everything so that they can provide one whole service. But the problem then with that, if you're then trying to be all of those things I said, and then you're trying to add in holistic, then you want to be like a breathwork practitioner, and you want to do neurology, and you want to do this. You kind of like look at someone, and then you're like, I don't even know where to start, because they could be having this and they could be having that, and it gets a bit overwhelming. I think it would be really good to have that appreciation for the other professions, and if you can work together to be like, right, this person might literally just need one session with this neurology specialist, that might actually help reset the body a bit more, and then that might actually allow myself, for example, to then be able to treat them better and actually get better outcomes because they've had a nervous system reset or something like that, and then it might actually enhance what I do. And I think you've just got to appreciate that the people who are specialists in their field are specialists for a reason, and it's not necessarily like I'd much rather go and see someone who was as good as they are in their field than someone who's kind of just like, oh, I've dabbled a little bit in it and I'm going to try it a little bit, like, in my opinion. Because also, if you are because, like, as I said, I would love to have a team that is in the future that's like that. Like, ideally in my head, I'd want to have like a Pilates instructor. I want to have a neurology specialist in the team, so that I can then be like refer between all of us, and we can all still learn from each other. It doesn't mean to say that I'm going to specialize in what one of them does, but you can still learn and you can get appreciation and you can identify when you know that person needs this,
Mm.
rather than being like, I don't know what's going on here. I need to refer you, but I don't know where. I think everyone needs to have the appreciation of knowing who to refer to. I think that's that point. But then you can then refer to the right person and then like a specialist in that field, because it, you can still get like, it's still a learning experience for everyone in it. And like I think on the last podcast, like,
Yeah.
I'm still learning all the time. Everyone's still learning all the time. And if you're not learning, you're not progressing in the service that you're providing at all. And just because you're learning something doesn't mean that you have to specialize in it. It's just you've learned something new and you're like, right, okay, well, if I ever see that, that might be a sign to be like, maybe I need to ask these questions and maybe I need to identify this. Okay, I found that, right, I need to refer to X, Y, and Z, because I think that that's what this person might actually need. Again, if you're doing it for the right reasons and if you're trying to get them better, you know that when it's out of your remit.
Mm. I love that. And this is a very tenuous analogy, but what was coming up for me in that was when you're assembling a diverse set of specialists and skill sets, and you're essentially trying to come up with one joined up thing that makes sense of it all that is maximally effective. It reminds me of mixed martial arts in that you
I love it.
but hear me out. Like when you think about it, so many of the individual martial arts are incredible for certain aspects of fighting, but then when they're put up against the mixed martial artists, they actually don't hold up. So when you're learning, for example, jiu-jitsu for mixed martial arts, it's very different to just traditional
Yeah.
Brazilian jiu-jitsu where you're in a jiu-jitsu competition and a lot, there's no striking allowed, there's a lot more rules. And the same even goes for kickboxing. The way you learn to do kickboxing for kickboxing fights, it exposes a lot of weaknesses if you come up against somebody who does mixed martial arts where they can do wrestling, they can do
Yeah.
grappling, there's the ground game as well. So the way I'm seeing it with all these different specialists is it's Bruce Lee quote, I think, is like keep what is useful and
Yeah.
discard what's not. It's almost like you need to cherry pick the best bits from chiropractic, from physio, from neurology, from personal training, strength and conditioning, and blend them together into this combined skill set, which has the best of everything and discards all the bits that don't really work or aren't really that useful. And it is very, very similar to the way that people are going about mixed martial arts nowadays, and that they're trying to not take on the purest sense of each martial art, because in the extreme, they actually make you vulnerable to actual mixed martial arts fighting. And yeah,
That's
I never thought about it like that. So
that is
thank
the
you for
best
prompting the thought.
analogy. But it's so true. It's so true. You're just picking the best bits of everything
Yeah.
and actually coming out on top, because you've got the best of all the things, and then you're just an all round great martial artist, basically. Yeah.
Yeah, I think that is it, and it actually means you discard loads of the traditional parts because yeah, when it comes down to it, there's going to be a lot of overlap and a lot of
Yeah,
waste and duplication. So
I love
maybe
that.
that's a good place to.
Love it. That is great. That is great.
If you would like to add another skill set to your toolkit, whether you are a clinician, physio, osteo, chiro, or a coach, personal trainer, Tash and I will be hosting a workshop in London on the 22nd of November at Revival PT Studios in Hammersmith. We're going to be discussing how you can become a hybrid clinician. You're going to learn the must know movement mechanics assessments to identify the common causes of many injuries, also, how you can turn your findings into fixes and program and prescribe exercise at a more sophisticated level than almost anybody out there. Tash is also going to take us through hands on treatments that complement all this movement mechanics and traditional therapies as well. So you're going to walk away ready to go on Monday morning with these new skill sets, some tools and resources we'll prepare for you as well. But if that's something that you'd be interested in adding to your career development, the further details will be in the description box below. Hope to see you there.